Kaiser Permanente nurses want us to trust nurses, not AI. This is a leaflet I received from members of the California Nurses Association outside of the American Hospital Association Leadership Summit in Denver. They were protesting Kaiser Permanente CEO Greg Adams' talk at the conference. These nurses are in the middle of bargaining for their union contract, and one of the things they're concerned about is their overall say in Kaiser's AI strategy. So here is one of the protesting nurses who can explain a little bit more about their stance.
So my name is Tara Deason, and I am a nurse at Kaiser in Santa Rosa, California. And we are here today to protest the use of AI by Kaiser. Kaiser is making billions and billions of dollars in profit, and they are investing a lot of that money into AI. The issue with that is that they're using AI to determine all kinds of things that nurses would normally determine, such as how many nurses we need actually in a day on the floor. Basically, they're using AI to assess how patients are actually feeling and what kind of treatment they're going to get. They're using AI to basically, the concern is that they're going to use AI to start to replace us because they're using a lot of AI to actually treat patients and assess just how sick they are, which that's only something a nurse can actually do.
Inside the conference, I listened to Greg Adams' fireside chat, and he did address the protesters briefly at the beginning, saying that he's willing to listen more to their input. And when I reached out to Kaiser Permanente, the health system struck a similar tone, and it said that it values its nurses and it's willing to listen to their input about AI strategy. I see a couple things at play here. The first being Kaiser Permanente nurses and their ongoing struggle to feel like their voices are being heard. I've covered a lot of their labor strikes in the last couple of years, most of which have been over what they say are unsafe staffing levels. So Kaiser nurses protesting, demonstrating isn't necessarily anything new, but there is a larger conversation here about frontline clinicians and staff members at a health system and how they feel about their say in the organization's overall AI strategy. This month, a former research director at Mayo Clinic filed a lawsuit against the health system, and in her complaint, she said that she was brought on to help oversee AI strategy and AI governance at the health system, and after raising concerns about patient privacy and safety lapses, she was demoted and ultimately fired, according to her complaint. So I think there is a story to watch here about frontline clinicians and staff members at providers and how they feel about their organization's overall AI strategy and the say that they have in that.